Evidence-based exercise programs, from the clinic to the community. A film by Cherie Hubert, physical therapist assistant. In a recent article in Geri Notes, a journal of the Academy of Geriatric Physical Therapy, Sherry Betts offers this definition. Evidence-based programs are research-supported programs to promote health and prevent disease and include components for behavior change and self-management. Evidence-based programs are programs that are created for a target population and have been proven safe and effective in randomized controlled trials. Many are supported by federal funding, as more and more emphasis is placed on providing programs that are based on solid evidence. In the lab, researchers design studies that establish best practices by testing various treatment interventions under different conditions. Experiments are done in controlled laboratory conditions with limited variables and homogeneous subjects. In the clinic, therapists evaluate research studies for validity, reliability, and applicability to a particular patient population, so the techniques can be used effectively for a specific patient. Some research, however, could benefit the health of the community at large, especially older adults, who are often excluded from laboratory research due to confounding comorbidities. To be safe for the general public, widespread public health initiatives must provide conservative recommendations. One size, as the saying goes, does not fit all. Health officials recognize that special initiatives have to be instituted for major health risk categories, such as heart disease, diabetes, or arthritis, or for special populations, such as older adults, children, or low income. These special initiatives require programs that are supported by research to promote health and prevent disease in target populations. So how do we translate current evidence-based practice into evidence-based programs that can benefit groups of people in more diverse populations? We can start by looking to government agencies that provide support with information and funding. For example, the CDC is attempting to increase utilization of these programs by creating partnerships with other agencies for funding and delivery, as well as promoting the benefits to healthcare workers and people with arthritis and other chronic illnesses. The Older Americans Act includes funding for programs that help seniors through Title III-D. Evidence-based programs must meet certain criteria for eligibility to receive Title III-D funding. The Administration for Community Living, ACL, has set the following standards for programs to be considered evidence-based. This is an example from the U.S. Department of Health and Human Services Agency on Aging website. To meet their funding criteria, programs must be proven effective for improving the health and well-being or reducing disease, disability, and/or injury among older adults. They must use research that is tested through experimental or quasi-experimental design and published in a peer-reviewed journal. They also must be tested in a community setting. Each state's Area Agency on Aging may have their own specific requirements to be met. A useful framework for evaluating the impact of research interventions through the translation from clinic to community is the RE-AIM framework. RE-AIM is a tool to help program planners and policymakers implement interventions to promote healthy behavior in the public sector. RE-AIM is an acronym for the 5 critical elements of program development: reach, effectiveness, adoption, implementation, and maintenance. Reach refers to determining the needs of the demographic of the area and providing access to people who would benefit by being users of the program. Effectiveness of the desired outcomes is verified by continued research to ensure that the gains received in the experimental setting carry over consistently when the intervention is presented in community programs. Adoption, implementation, and maintenance depend greatly upon the ultimate providers of the program in each community. Providers must have the resources, staff, and space to implement the program as desired. It is also vital to secure partnerships among government agencies, community coalitions, community-based organizations, and institutions to secure funding, recruit participants, promote programs, and provides staffing to operate the programs. Communities seek out programs that are proven to make an impact, easy to replicate, consistently implemented, and maintain ongoing data collection. Maintenance is measured in long-term gains achieved by participants, as well as the ability of the providers to offer the program repeatedly and consistently. This requires training and tools for data collection and participant recruitment. Re-AIM is an ongoing process for development and evaluation. The cycle continues. Even after an evidence-based program is introduced into the community, further research is carried out to determine if the program can be beneficial to other groups, or if further refinement of the program is necessary to reach a certain demographic. Several successful evidence-based programs have been developed using this model. Here are a few that are currently available for older populations, addressing issues of fitness, arthritis, and falls prevention. In this film, I've used the example of using rehabilitative research in the lab to guide the application of therapeutic exercise in the clinic, then broadening these interventions used to treat specific individuals to specific populations in the community through development of evidence-based exercise programs. This film's conclusion ends with you. If you are involved in the experimental phases of research, I urge you to keep the needs of the community in mind as you form your research questions. Ask yourself, are the expected outcomes meaningful and relevant to the needs of the community at large? How can I replicate this research to make it applicable to more diverse populations? If you are a clinician, you may want to consider recommending an evidence-based exercise program to your patients so they can continue to be active after they leave your care. Many local agencies could also use your assistance to implement new programs or volunteer to teach a class. If you are a community leader, my hope is that you will support and implement evidence-based programs to extend the reach of interventions that enhance the health and well-being of special populations or target the major health risk categories in your area. Thank you for watching Evidence-Based Exercise Programs from the Clinic to the Community by Cherie Hubert, Physical Therapist Assistant.